Hi, this is Dr. David Tener. We're here at the Goldberg Tener Clinic where we specialize in the reversal of chronic disease, and today I'm delighted to be joined by our patient, Miss Barbara Scurry. Barbara lives in Peachtree Corners, Georgia, right? And she came to see us. This was in February of 2020 was her first visit.
Wow.
That's a while ago.
Yeah.
Today is March 30th, 2021. So fast forward a year and about a month. And Barbara has gone through a transformation. We are delighted with her progress. She is going to share her story with us today. And so Barbara, I'm going to let you do most of the talking.
Oh,
so
gosh.
tell us what has transpired. So when you came in originally in February, tell our audience a little bit about your primary concerns.
Well, let's see. I have my whys here. So some of the issues I was dealing with, I was starting to have like high blood pressure issues when I was going to the doctor. They were having to check my blood pressure multiple times to make sure, that the reading was correct. I was overweight. I had pre-diabetes. My A1C was starting to get at like 5.6, 5.7. I was diagnosed with osteoarthritis in my knees. I was having issues with plantar fasciitis and bone spurs in my heels. I think in like 2017, I had, for most of that year, I was in a boot. I mean, it was terrible. I had systemic inflammation all over my body. And I had ongoing gastrointestinal issues for 25 years. I either had ulcers or gastritis, GERD, IBS. I mean, I was just a mess.
Had you seen other doctors prior to coming to see us?
Actually, I had. I've actually seen a couple of different like integrative specialist type doctors in the Atlanta area. And unfortunately, I just didn't find success with them.
So we did a thorough evaluation when Barbara came in, did some lab work. We found that, yes, your blood sugar was high, your blood pressure was up. She had a high C-reactive protein initially, which is a measure of systemic inflammation. It's also an indicator for a high risk for heart attack and stroke. It's also associated with increased risk for cancer. So there were some red flags that popped up that we certainly needed to address. So we got Barbara started on a program based on the evaluation that we did. And a year later, Barbara, what's changed?
Well, from my heaviest weight, I'm down 90 pounds as of today. 90 pounds.
That's quite a lot.
I'm in my goal pants today, like the pants that was like the goal that I wanted to be in. I'm in them today, and I still, have like 20 pounds to go to get to where I really want to be at. My A1C went down. I'm no longer pre-diabetic. My systemic inflammation went way down. I mean, that was like...
And we saw that on your lab work. So her CRP, which is a measure of inflammation, went from 5.03, which is significantly elevated. The normal range is less than 3.0. We like to ideally see around 1. So it went from 5.03 down to, and this was last time we were here, we rechecked it, it was 1.71.
Wow.
Much less. And
Yeah.
certainly that's reflective of the improvements that you've had. So
Yeah.
go ahead, sorry.
My joint pain is like almost non-existent. I remember my husband would be so concerned when I would go up the steps. He could hear the crunching in my knees, and like that's not there anymore. My blood pressure is like back to normal. And my gastrointestinal issues just went away. And I just wanted to kind of go back to what you were saying about how you guys treat things differently, because when I went to those other doctors, I mean, I just got all of the pills and the potions. I mean, I literally had like a box of supplements that I had to take. And I used to joke and say I had my own little mini pharmacy at my house that, I had all these pills that I was supposedly taking. And again, those things just didn't work, at least not for me.
Yeah, it's just another form of medicine. So rather than give people more pills and more medicines to take, we want to get down to the root issues and get you starting to do the right things to create the right conditions to build health, which of course doesn't happen when all we do is take supplements or other treatments. One of the things I wanted to mention is Barbara, one of her major goals when she came in was she wanted to lose weight. She wanted to normalize her weight. And she's gone through many yo-yoing type periods with that over many years. And we worked with Barbara to try to change her mindset about that. Because we see people that are overweight, we see people that are underweight. And in any case, the goal is to not force the body to gain weight or lose weight, depending on what the goal is, but to do the right things to build health. We find that when we build health and people get healthy and balanced, then wherever their weight is, will go back, it will normalize on its own as a nice side effect of that. There's a lot of different ways to lose weight. There's all kinds of diets and pills that you can get from medical weight loss centers and things. Not all of them result in good health, though. That's part of the problem. That's why you see people kind of yo-yo back and forth repeatedly. So the best way to address weight issues, in our opinion, is to simply work on building overall health. When you get healthy, the weight will go back into the normal range on its own. And the nice side effect of that is, of course, you got healthy in the first place. So it all works together. And so by getting healthy, not putting you on a weight loss program per se, but by working on getting you healthy all over, you've lost 90 pounds, blood sugar's balanced, digestive issues are gone, joint pains are less, energy's up. You've restored your health. I mean, you've transformed yourself, you've been recreated. That's the beauty of it.
Yeah.
And the results you've had are certainly a great example of that.
Yeah, it's awesome.
So thank you, Barbara, for sharing your story. You've certainly earned all these nice improvements. We, of course, can only give Barbara the right advice. She has to go home and make use of it. So she exhibited a tremendous amount of discipline, put forth a significant amount of effort, and was also very patient. Yeah, it took a full year to turn all this around with her, but now in her early 50s, she has a hopefully long life ahead of her to be in good health and enjoy the many pleasures of life.
Yes.
So thank you, Barbara, for sharing your story.
Thank you. Thank you for all the help and the encouragement and, yeah, the guidance. I appreciate it very much.
Welcome.